Let me ask you something. When was the last time you left a doctor's appointment feeling relieved, only to receive a phone call a few days later asking you to come back for one more test? For many older adults, that's where the real stress begins. Not because they were sick, not because they had symptoms, but because a routine checkup uncovered something unexpected. Sometimes that discovery saves a life, but sometimes it opens a door to months of anxiety, more scans, more appointments, and treatments that may never have been necessary. That's a conversation we don't have often enough. My name is Dr. Franklin, and on this channel, we focus on helping adults over 65 make informed health decisions based on evidence, not fear. Today, we're talking about 5 medical checkups I personally think deserve a second conversation before saying yes. Notice I didn't say never. These tests absolutely have an important place in medicine. But after the age of 65, or especially after 70, the balance between benefit and risk can begin to change. The key question is no longer, can this test find something? The better question becomes, will finding something actually improve my life? That one question can completely change how you think about healthcare. By the end of this video, you'll know which routine screenings deserve a thoughtful discussion with your doctor, what questions are asked before agreeing to a test, and how to avoid unnecessary procedures while still protecting your health. And make sure you stay until the final checkup. It's one that thousands of healthy seniors receive every year, even though many experts recommend against it for people without symptoms. Before we begin, I'd love to know where you're watching from today. Leave your city or state in the comments. I enjoy reading every one of them, and it's always amazing to see this community from all over the country. Now, let's get started. Before we begin, one important principle. Before I show you the first checkup, there's one idea that ties this entire discussion together. Think of your health like maintaining a house. If your roof is leaking, you fix it. If your heating system stops working, you repair it. But you wouldn't tear down perfectly good walls just to see if something might be hiding inside. Medicine works the same way. Some tests are designed to investigate symptoms. Others are designed to screen healthy people for hidden disease. Screening can be incredibly valuable. But as we grow older, our bodies also become more vulnerable to the risks that come with follow-up procedures. A tiny abnormal finding can lead to another scan, then a biopsy, then surgery, and suddenly, someone who felt perfectly healthy is recovering from complications instead. That's why every medical decision should answer one simple question. Will this information change my care in a meaningful way? Keep that thought in mind as we go through today's list. Checkup number 1, annual full-body CT scans. Let's start with one that's becoming increasingly popular. Full-body CT scans marketed as a way to catch disease before symptoms appear. The advertisements are persuasive. Get peace of mind. Find hidden problems early. Take control of your future. Who wouldn't want that? But here's what many people don't realize. A CT scan sees almost everything. And that's exactly the problem. As we age, our bodies naturally develop small cysts, harmless nodules, scar tissue, and age-related changes. Most of them never cause symptoms. Many never require treatment. Yet once they are discovered, they are very difficult to ignore. Imagine this. Your scan shows a tiny spot on your lung. The report says, probably benign, recommend repeat imaging in 6 months. Now you spend half a year wondering if it's cancer. 6 months later, another scan. Maybe the spot looks slightly different. Now you're referred to a specialist. The specialist recommends a biopsy. The biopsy comes back normal. After months of anxiety, nothing dangerous was ever there. This happens far more often than most people realize. Another concern is radiation. A single CT scan exposes your body to much more radiation than a standard X-ray. While one scan isn't likely to cause harm by itself, repeated scans without a clear medical reason add exposure that may not provide meaningful benefit. So what should you do instead? If you feel well and have no concerning symptoms, focus on proven preventive care. Keep your blood pressure under control. Manage cholesterol. Stay physically active. Eat a balanced diet. And keep up with screenings that are appropriate for your age and personal risk factors, not tests marketed to everyone. The goal isn't to find every tiny imperfection. The goal is to stay healthy enough to enjoy your life. Because sometimes, The healthiest person in the room is the one who doesn't go looking for problems that never needed to be found. Checkup number 2, large executive health blood test packages. Let me tell you about someone I'll call Michael. Michael was 69 years old. He exercised 3 times a week, kept his weight under control, and rarely missed a doctor's appointment. One afternoon, he saw an advertisement online. Complete health screening, over 100 blood tests. Know everything about your health. It sounded like a smart investment, so he booked the appointment. A few days later, his phone rang. One of your results is slightly outside the normal range. That single sentence changed the next 3 months of his life. More blood work, more appointments, more internet searches late at night. Eventually, every follow-up test came back normal. Nothing serious had ever been wrong. So why did this happen? Because the more tests you perform, the greater the chance that something will appear slightly abnormal. Think of it this way. Imagine throwing one dart at a dartboard. The chances of missing the center are pretty high. Now throw 100 darts. Eventually, one will land somewhere unexpected. Blood tests work in a similar way. Most laboratories define normal by using statistical ranges. That means even healthy people will occasionally have results that fall just outside those limits. Not because they are sick, but because human biology naturally varies. That's why doctors don't treat lab numbers. They treat patients. A slightly unusual blood result without symptoms often means very little on its own. Instead of ordering every available blood test each year, ask your healthcare provider which tests actually fit your age, your medical history, and your personal risk factors. More testing doesn't always mean better care. Sometimes, it simply creates more questions than answers. Checkup number 3, routine cardiac stress test when you feel fine. Now let's talk about one of the most misunderstood heart tests, the cardiac stress test. Many people think, I'm getting older. I should probably check my heart every year. That sounds reasonable. After all, heart disease becomes more common with age. But here's the important distinction. A stress test is designed to investigate symptoms. It isn't always useful as a screening test for people who feel completely healthy. Imagine your smoke alarm going off every afternoon. Even though there's never a fire, eventually, you will stop trusting it. Medical tests can behave the same way. Sometimes they produce results suggesting a problem that isn't actually dangerous. Doctors call these false positives. Once that happens, the next steps often become much more invasive. Additional scans, contrast dye, cardiac catheterization, sometimes even procedures that carry their own risks, all because of a result that may never have represented a real threat. Now, if you've been experiencing chest pain, shortness of breath while walking, unexplained fatigue, or dizziness during activity, that's completely different. Those symptoms deserve prompt medical evaluation. A stress test may be exactly the right choice. But if you're walking every morning, climbing stairs comfortably, gardening, playing with your grandchildren, and your doctor simply says, let's do one just because it's been a while, it's perfectly reasonable to ask, how will this test change my treatment if the result is abnormal? That's not being difficult. That's being informed. One of the most valuable conversations you can have with your doctor is understanding why a test is being recommended, not just what the test is. Because every medical decision should have a clear purpose, not simply become another item on a checklist. A quick pause. If you're finding today's discussion helpful, take just a second to leave a comment below. I'd love to know, what's one medical test you always wondered whether you really needed? Your question might help someone else who's thinking the exact same thing. Checkup number 4, bone density scans that automatically lead to medication. Let's talk about something that often starts with good intentions. A bone density scan, also known as a DEXA scan. Now, don't misunderstand me. Bone health matters. A broken hip after 70 can be life-changing. The question isn't whether your bones deserve attention. The question is what happens after the scan. I've met many older adults who received a report showing mild bone thinning. Before they had time to ask questions, a prescription was already waiting at the pharmacy. No conversation. No discussion about exercise. No review of diet, just medication. Here's why that concerns me. A scan tells us about bone density. It doesn't tell us everything about fracture risk. 2 people can have very similar scan results. yet completely different chances of falling. Think about it. One person walks every day, practices balance exercises, has excellent vision, lives in a home with good lighting and no loose rugs. Another rarely leaves the house, takes medications that cause dizziness, has poor eyesight, and struggles with balance. Who is more likely to fall? Exactly. Sometimes preventing a fall is more important than chasing a number on a report. Before starting long-term medication, ask your doctor, what else can I do to protect my bones? You might be surprised how much difference regular strength training, adequate protein, vitamin D when appropriate, and balance exercises can make. Medication certainly has an important place for some people, but it should be part of a thoughtful plan, not an automatic response. Checkup number 5, carotid artery ultrasounds without symptoms. Now we come to the checkup that surprises almost everyone. An ultrasound of the arteries in your neck. The goal sounds reasonable. Look for narrowing before it causes a stroke. Who wouldn't want that? But medicine is rarely that simple. As we grow older, small amounts of plaque inside the arteries become increasingly common. Finding it doesn't automatically mean it needs treatment. In fact, many people live for years with mild narrowing and never experience a stroke. The challenge begins when a routine scan discovers something unexpected. Now another specialist becomes involved. Additional imaging is recommended. Discussions about procedures begin. And suddenly, someone who felt perfectly healthy finds themselves facing decisions they never expected to make. For people without symptoms, many medical organizations recommend focusing first on the things we already know reduce stroke risk. Keeping blood pressure under control, managing diabetes, taking prescribed medications correctly, avoiding tobacco, staying physically active. These habits consistently provide far greater benefit than searching for problems that may never become dangerous. If you've had warning signs like sudden weakness, vision loss, difficulty speaking, or a transient ischemic attack, that's completely different. Those symptoms deserve immediate medical attention. But for someone feeling well, routine screening isn't always the best first step. The 5 questions every adult over 65 should ask. Before you agree to any screening test, pause for a moment, then ask these 5 questions. Question 1. Why am I having this test? Is it because of symptoms or simply because of my age? Question 2. If the result is abnormal, what happens next? Understanding the next step is just as important as understanding the test itself. Question 3. Will finding something improve my quality of life? That's a powerful question, especially as we grow older. Question 4. Are there safer or less invasive alternatives? Sometimes the answer is yes, and sometimes that's a better place to begin. Question 5. What would happen if we simply monitored this instead? Not every abnormal finding needs immediate treatment. Sometimes careful observation is the wisest choice. Final thoughts. If there's one message I hope you remember today, it's this. Good healthcare isn't about doing more. It's about doing what truly matters. Modern medicine has given us remarkable tools, but every test, every scan, every procedure should have a clear purpose. The goal isn't to collect diagnoses. The goal is to help you stay active, independent, and able to enjoy the people and moments that matter most. Never be afraid to ask questions. A good doctor won't be offended. In fact, most appreciate patients who want to understand their care. Healthcare works best when it's a partnership, not a one-way conversation. So the next time someone recommends a medical test, don't ask only, should I do it? Also ask, how will this help me live better? Sometimes, that single question changes everything. If today's discussion gave you a different perspective on routine medical testing, please take a moment to like this video. It helps more older adults discover practical, evidence-informed health information. And if you enjoy clear, balanced explanations without unnecessary fear or confusing medical jargon, subscribe and join our growing community. Every week, we explore simple ways to protect your health, maintain your independence, and make informed decisions with confidence. Finally, I'd love to hear from you. Have you ever had a routine medical test that led to unexpected follow-up appointments or treatments? Share your experience in the comments. Someone reading your story may feel less alone and may be inspired to have a more informed conversation with their own doctor. Thank you for watching. Take care of yourself. Stay curious. Stay informed. And I'll see you in the next video.